Botox versus Dysport. There are actually four medications which are in this Botox category called neuromodulators, and they're all very, very similar but have little differences. And so Botox tends to be packaged in a little bit different or a different molecule than Dysport. Everybody will have different, every office or every injector may have some different preferences. In our practice, we offer all four of the medicines, but Dysport is a clear winner in our patient satisfaction surveys. And this actually stems back from a self study I did on my own self. Let's reference that in a picture. But I injected half of my forehead with Botox and half of my forehead with Dysport. And Dysport works faster, and anybody will tell you that. So you actually start getting the effects of your investment quicker, which adds more value to the procedure, in my opinion. The other thing was that, to me, the Dysport worked a little bit better in my body and in the bodies of most of our patients. And then the third thing is that in that same study that I'm referring to with my own forehead, the Dysport lasted longer than the Botox. So those three things, both the onset, Dysport 1, the strength or kind of how it looked in there was also Dysport 1 that, and the longevity, Dysport 1 out again. So all three things that I was looking at. Important to note, they were mixed the same way, and I injected it myself, the same areas, symmetrical right to left. And so I felt like all of the variables that could be were controlled for. So that's that. And as far as who does the injections in our office, I currently do all the injections. However, that may be changing in the near future. Well, I will always plan to and still do injectables, but since our backlog and our waiting list has gotten so long, in an effort to continue to treat our patients, we are now training some injectors and also are in the process of hiring potentially a new master injector to help treat and take care of our patients. Regardless of who's doing the treatment, it's my absolute desire to make sure that we all do this in the ways that I've found to be very efficacious and effective for our patient population. So no huge announcements now on that front, but stay tuned, and there may be coming soon.